patients tend to get way too many inappropriate numbers and populations of bacteria in their small intestines, and they get bloated when they eat. They get loose stools and diarrhea and abdominal pain. So that's the reason for, if you're having GI symptoms, that's why people feel better when they fast.
Right.
Because you're allowing more of those migrating motor complexes to help improve the motility.
Welcome back to another episode of the Peak Performance Life podcast. Today, we have a very special guest. His name is Dr. Mather, and he is a board-certified family practice physician and the medical director of the Ruscio Institute for Functional Medicine. He graduated from Tulane University School of Medicine and Tulane University School of Public Health and completed his residency in 2014. He is passionate about delivering cost-effective and practical medical care with a focus on GI health and environmental toxicity. He spends a lot of time working with patients suffering from complex and chronic diseases. And when he's not working with patients, you might find him chasing his 3 small children, exercising, or playing music. So, Dr. Mather, thank you so much for joining us here today.
Hey, Talora, nice to connect with you. I'm happy to be here. Thank you.
Awesome. Well, let's jump right into it. And is there do you want to tell anything about your backstory before we jump into kind of a high level of what functional medicine is as well?
Absolutely. Happy to. I'm a medical doctor, and I was one of those annoying people who kind of knew what I wanted to do from an early age, right? I just always wanted to be a doctor. I just kind of felt called to heal people. And so I put my life on that path to get through university and medical school, and then my formal medical training in family practice. And the long and short of it is I got to the end of my conventional medical training, and I just realized the tools I was given in conventional medicine wasn't helping my patients with chronic disease. I've been working with these diabetics and these people with high blood pressure, pulmonary issues, renal issues, and just no one was getting better. I was managing, right? Putting people on prescriptions, but nobody was improving. And I'm sure everyone here is totally shocked to hear that conventional medicine falls short sometimes. And so that started the journey of, okay, what else is out there? There's all these integrative medicine practices. There's alternative medicine. There is functional medicine. Which of this will help my patients? Which won't? And you fast forward, and I've spent the last almost decade now looking for the best tools that will help patients wherever they are. And functional medicine is kind of where I ended up. And so that's the long and short of it. It's just what helps people with chronic disease get better, because conventional medicine is striking out.
Yeah. And we hear that so much from, we've had a lot of doctors on this podcast, and it seems to be a common theme of like, we were prescribing, we were doing the common medical stuff, and we just weren't seeing the results we wanted. So we switched to, whatever it is, some sort of more holistic approach, and in your case, functional medicine. And now we've heard this term functional medicine thrown around a lot, but I'm not sure everyone really fully understands, what does it actually mean? Maybe we could start with just kind of a high level definition or overview of functional medicine.
Right. It's not at all clear. And the reason why it's a more modern development in medicine. There's not one standardized board certification or one single entity that says, okay, you're a functional medicine doctor because you did X, Y, Z. And to make things even more complicated, you have a kind of army of health coaches and dietitians, nutritionists saying that they're functional medicine providers, right? And so it gets really, really kind of confusing. To back it up high level, functional medicine is really an idea. And the idea is, what is the root cause that is making someone ill? And how do we fix that root cause, right? And we contrast that with conventional medicine. It's like, okay, you've got these pattern of symptoms, and here is a randomized control proven drug that will help reduce the symptoms or minimize the risk, but it forgets to treat the reason why they may have those symptoms. So functional medicine is in large part a reaction to a conventional medical system that forgets to think, why is this happening? Or doesn't have the ability to address why it's happening, right? That's
a great explanation, and that makes so much sense. And like so many people, I was dealing the same thing. When I had all this pain and inflammation in my arm, what did I do at first? I got a compression wrist sleeve and a compression elbow sleeve and pain relief creams and pain relief devices and all this kind of stuff. And it's like, that's just kind of putting a Band-Aid or trying to address a symptom, but it wasn't until I lowered inflammation in my body where I actually addressed the root cause of the problem. So I'm glad we're going to be talking about functional medicine, which is addressing the root cause of people's problems.
And there's nothing wrong with Band-Aids, right? When you're hurting, come on, throw the Band-Aids out there, right? That's why there's one of the things that conventional medicine is great at is acute care. Yeah. And I really wanted to work with people on a deeper level. So the functional medicine paradigm was much more attractive to me.
Nice.
The issue then, right, is that's just the beginning, because then you enter the world of integrative or functional medicine, and no one agrees on what's actually a root cause, right? You've got some doctors saying everything is insulin resistance, or this is a methylation problem, or you have adrenal fatigue, or you have a gut problem, or a nutritional problem, or it's your diet, or it's your environment, or it's the mold toxins. And it's completely bewildering for patients to be able to sort through what of this is actually true. And so that's where I think the real work is beginning in the field, is we need to get better at what are the things that are shown to help and what are things that are just kind of sound good, or maybe good ideas. Maybe that's a little crass way of saying it, but from my perspective, I'm the medical director of a functional medicine clinic, and we have the privilege to see people all around the world, right? So coast to coast and internationally, and the confusion is just all over the place. And we often see patients who have already been through a few functional medicine clinics and have been harmed, right? They've had these insane workups of tens of thousands of dollars. They've pursued IV treatments and ozone and crystals and herbs and diets and restrictive diets and more restrictive diets, and they're not better. And so the field really needs an upgrade. It really needs kind of a reckoning of which of these things are helping patients move forward, and what patients do which intervention work, and what do we need to leave behind. So that's where we see our role, is really trying to bring some evidence-based, kind of a skeptical or critical view of some of the over testing and over treatment that we're seeing, and just kind of getting on our soapbox as many times as we can on podcasts like this and saying, hey, this is what works over here.
Nice.
That's where we're coming from.
That sounds amazing. That sounds great. And I know you're seeing a lot of patients, like you said, patients who have been to many other doctors, many other even functional medicine practitioners. What are some of the what are some of the things that you're seeing? Obviously, you see a lot in your practice, but what are some of the common themes that you're seeing? And I guess, what are some of the ways that you guys do to address that?
Yeah, so I'll give you two answers, and then you can choose which rabbit hole, red pill or blue pill. The first huge miss is lifestyle, right? And so it doesn't matter if you go to a conventional practice and you don't get better, or a functional medicine practice. People just don't understand lifestyle, how absolutely critical that is to optimizing your health. And the conventional docs just aren't really trained in the diets, and so they really kind of fail there, and they don't have the time to think about exercise and sauna and sleep and stress. But unfortunately, I think the functional medicine doctors need to do a better job. They're getting too distracted with advanced lab testing or supplementation, and they're just forgetting this fundamental piece. And this is where everything is built on, right? If you don't have the foundation set, you're not building higher, you're not getting optimal results. And that's the biggest miss we're seeing in patients who come into us, is that no one took the time to stop and really think about diet, about sleep. Oh my God, for recovery, sleep is huge, right? About stress management. So that's kind of one of our biggest points. That'll be kind of door A. If you want to go down door A, we can go there if you want. Door B, maybe the next level issue is really getting the gut health right. Now, not every patient needs their gut optimized, not every patient, but a huge chunk of the patients who've been through the ringer, they're not getting better conventionally, they're not getting better functionally. They didn't do the right things for the gut. Maybe they tried a probiotic here or a little diet here, but they just haven't gone far enough in the right order with the gut. So we find manipulating the gut one of those huge levers that gives us a lot of advantage to get people better.
Interesting. Very interesting. Well, I think we're going to go down both doors, because I think they're both interesting.
Option C, huh?
Yes, exactly. So let's start then with lifestyle. So Let's start then with lifestyle. So what are the biggest lifestyle issues that you kind of see and that you guys address?
It's sleep. And I think the reason why it's sleep is that most people now know that they should eat better than they do, or they know that diet's important for reducing inflammation, right? Improving their immune health, lowering their blood sugar. Like, people get that, right? They may not know exactly the right diet, but by the time they've seen us, they've tried a couple and they've usually found some things that have gotten them better. So we don't spend too much. We're not like a diet Nazi clinic where you have to do X, Y, Z, right?
Yeah.
The same is true for exercise for the most part. Most people know they should be moving more. Most people know they should be exercising. And so sometimes they need encouragement or they need some specific recommendations. But again, by the time that people have come to see us, they're sick as hell. They've tried this, right? Sleep is the one that's really missed in our society. We are underslept as a society. It's causing a tremendous amount of problems with health, top to bottom. And I think it's not very well taken care of in modern sleep clinics. I think the idea in most conventional medicine is you to have sleep apnea that's treated with a CPAP Darth Vader mask.
Yeah.
That's kind of the only option they have. But the reality is that there's, dozens of lifestyle hacks that people can use to get their sleep better, right? And then on top of that, there are very low cost medical devices that can help if you do have maybe some upper airway resistance syndromes. There are devices that you can use for, it's like $50 for sleep positions. And so there's a lot of low hanging fruit. And sometimes the key to a patient who's really missed and done poorly is getting their sleep better. And then everything opens up. So sleep would be the first answer, top of my mind.
Yeah. And I mean, I've heard some, I don't know the stats off the top of my head. But I've heard, people with sleep apnea have much more risk of pretty much everything, right? And so getting that, so that's an interesting one. I experimented with taping my mouth shut when I sleep for a while.
How did that go for you?
It went well for a little while. I actually even had my daughter do it for a minute because I thought she was mouth breathing, but that didn't last too long with her. She's still young, but I may revisit that. I don't think I'm a mouth breather. I don't snore. I know a lot of people that do snore as well. And I know some people with sleep apnea. So the thing about taping the mouth shut at night, I think is a great thing if you can do it. You got to be careful. A lot of the tape is like really sticky. So sometimes I just put it on and off the sheet or the pillowcase a couple times to make it not as sticky. Then I'll put it over my mouth. But I did find myself, if I did wake up in the middle of the night or something weird, like I would just like kind of rip it off, or I'd be like, what's this thing on my mouth? So it was a little, it takes some getting used to, but I think it could be a powerful solution for some people. White noise machine definitely helped me. That was one thing.
White noise machine gets 2 thumbs up from me. The mouth taping, I haven't found it to be as helpful as I thought it might have been in my patients.
You've had them try it and they do it and just not seeing the results that you thought. Yeah. It's in a lot of the breath books, right? The breathing books.
It's everywhere. It's everywhere. Right. And that's the core of what we try to do in our clinic is, okay, here's this idea. Is mouth taping helpful? And there may be some biologic reasons why we think that might be a good idea, or some mechanistic studies, but the real, where the rubber meets the road is, okay, does this help my patient get better in a concrete way?
Right.
And
right.
That's where I think it's just not as helpful as I would have hoped. It kind of seems like a 50-50. Actually, maybe 25% of people who try it like it, 75% don't.
My wife won't even do it. She's like, I can't even tape my mouth shut. Like she's like afraid. I'm like, what if I can't get the oxygen? What if I can't?
I know. Yeah.
It's kind of weird for a lot of people.
Yeah.
For me, when I did wear the Aura ring for a while, which I stopped wearing because I started becoming crazy about it and waking up in the morning and running to check my score. And then if I had
that might be a fun podcast topic.
It kind of messed up my day. Like when I'm like, oh man, I got a bad score. And then I was like, you know what? I think I've tested the things that I wanted to test, and now I don't even want to know. If I have a bad score, I'd rather just go about my day without knowing because it messes with my head. So anyway, when I did test, obviously, I had my Aura ring one day on New Year's Eve, and that was we were drinking that night, and I haven't drank in over a year now, but that was destroyed, like the worst sleep score ever.
Sometimes it's worth the price of admission for an Aura ring, just so people can realize how absolutely devastating alcohol is to your sleep. And whereas so many people, I'm coming to you from New Orleans, people drink a lot here.
Yeah.
And oh my goodness, it is shocking for people to kind of get their baseline and then have even one drink, two drinks, and just watch their sleep scores plummet. It's eye-opening for sure.
Right. What else are you seeing?
Learned.
What are some of the biggest destroyers of sleep that you have people stop or do?
So the answer I'm going to give is going to be kind of annoying because it's the easiest one to say, but the hardest one to actualize. Chronic stress. It's just how worried are you throughout the course of the day? How many times has your heart rate got elevated because of a shitty email? How much are you chronically worrying about getting your kid to school and then going through your day and then getting your kid fed at the evening and then you've got to check your email? It's the sum total of your stress. That is, in my clinical experience, the thing that's the hardest to measure, but again and again, this is the thing that is most directly tanking people's sleep. So it's very easy for me to say that. It's much harder for me to fix that with patients. We talk about meditation. We use some herbal tools and we talk about those things, but that truly takes some personal work doing that. Some time management skills can go a long way here.
Yeah, because stress is so like subjective. And by the way, great book recommendation. I love this book called The Upside of Stress. The Upside of Stress.
Yeah.
It really helped me reframe the way I look at stress, because sometimes you could be like, oh, this is so stressful. This is so stressful. And the way you're looking at it makes you more stressed, right? Because like what is stressful to Elon Musk is not stressful to me, essentially, right? or vice versa. So that's a tough one, right? Because like, especially for you as a functional doctor, like, how do you help? Like that's work that people have to do on themselves. That's like personal growth type stuff, isn't it?
It is. And so sometimes it's a good doctor's knowing when they're out of their lane. And for me, identifying a problem with the patient and saying, hey, I think this stress is an issue. Here are some tools I know medically have helped other patients, but I really think you need to take some time and figure this out, or and put it on the patient, because it's not my job to problem solve every aspect of someone's life. Right. And ultimately, I think a healthy doctor-clinician, doctor-patient relationship, I can say that. I can say, this is I think you've done X, Y, and Z, and I really think this is a stress problem. Here are some things I think can help, but I think you need to focus here. Spend some time on it. Let me know in 5 weeks how you're doing. Yeah. So
anything else on the sleep side of things that you think people should know about, or lifestyle side of things in general?
I think they would have to take away the MD at the end of my screen there if I didn't say going to bed at the same time and waking up at the same time is just so basic. It's hard to do for all of us, but it's so critical. Having a period of time, it doesn't have to be more than 30 minutes where you're letting go of the day. You're reading a book. There's a dark room. You're not checking your phone. You're not watching TV, where things are just, there's a transition from this was my day, and now we're going to wind things down, and now I'm going to go to bed.
Yeah.
That's so hard to do today with our phones and our tablets, but it's important and it makes a big difference. The last thing I'll say is the blue light exposure close to bed is devastating for sleep. Right. So,
do you recommend blue light blocking glasses?
I do. Yeah. Those are one of the things that I was like, there's no way that these stupid orange glasses are going to help. I was like, this is just stupid. I've got they're in the other room. I've got a pair. They look so dumb.
I know. I wear them too.
They really work. They work. I had a patient, this was years ago when I was running an internal medicine practice. I had this little old lady, and she had tried every single supplement and med and all that, and she just wasn't sleeping. And I said, you know what? These glasses are like $9 on Amazon. Like, just go put them on and email me in a week. And she's like, my insomnia is gone. And I was like, okay, this is one of those things that's going to shift the needle.
Nice.
And so that can be really helpful.
Great. Anything else just before we wrap up on lifestyle and move over to the gut health side of things? Besides sleep, anything else on the lifestyle side of things?
Let's go to gut.
Yeah, let's go to gut health. We talked about stress. Stress is not just sleep. Stress is all around, and we talked about sleep. So yeah, let's definitely go into gut, because I know that's definitely an area of expertise for you.
Yeah.
So talk a little bit about the gut and how it controls different things and how you're addressing that.
Yeah, absolutely. So when we kind of at the top of this call, we're talking about how there is all of these claims in functional medicine of what is a root cause. And one of the gut is so very clearly a root cause because fixing it resolves so many symptoms for a lot of people,
Mm,
right? So that's one reason. It's whereas, when I was in the habit of trying to do adrenal fatigue work and really give nutrients for adrenal fatigue and adaptogens, just didn't do much. I just didn't see people getting better. That's not a root cause. When I started treating patients who had autoimmune thyroid disease or chronic fatigue and brain fog and anxiety and depression with a gut-focused approach, those things started getting better.
mm,
So that to me, just historically, was one of the signs. Okay, this is a truly a root cause. And so, going into it more, why is the gut important? The gut is by far the biggest entranceway into the body, right?
yeah.
Mouth to anus, you've got a huge amount of surface area internally. And because it's the biggest entranceway to the body packs it full of immune cells for self-defense, right? It doesn't want invaders coming in from that opening into the body. We'd be overrun by viruses and bacteria and all sorts of proteins and food additives and red dye number 5 and bisphenol A and all the shit that we get exposed to, right?
Right.
So the body packs immune cells around the gut. So the mental image I think of tell people is to think of a tube running top to bottom, and around that tube you're just packing silly putty, right? That's the immune system.
Hmm.
If you want to change the immune system, you change the gut because they're so closely interrelated, right? It's very hard for me to change kidney function.
Yeah. Interesting.
Or spleen, right? That they're
Right.
buried deep inside the body. I mean, this is
Right.
very, very kind of maybe stupid, but it's one of those simple truths is that I can change the gut health very quickly by changing what you eat.
Oh, yeah.
I can give you probiotics. It goes right where you want to. It doesn't have to get absorbed and find its way to the spleen, right? It's right there.
Mm-hmm.
So you can very quickly make changes to the gut and then say, okay, did the brain fog go away? Did your joint pain go away? Is your rosacea better? Right? The answer is either yes or no. And often it's yes, right? You make that change and you see the effect in another system. You know that patient's root cause was a gut dysbiosis or SIBO, right? Or a problem internal to the gut. So practically speaking, it's easy to fix. It's right there. You just got to swallow things. And it's one of those major levers that helps people get better.
So what are some of the gut destroyers then? What are some of the things that people are doing that are getting them into this situation, destroying their gut? And then maybe what are some of the things that you're doing? You mentioned probiotics and what are some, are those just like regular ones that you buy, as a supplement, or you special type? Just kind of curious.
Yeah. So for kind of the general person listening, the destroyers are chronic stress, because when you get chronic stress, the body says, uh-oh, I'm in trouble. I need to fight. And so it will ramp up immune production, cortisol, epinephrine, the stress response, and it will turn down the digestion, right? So you don't produce as much stomach acid or bile or enzymes that break down the food. And so you get some extra fermentation in the small intestine. You get disorder of the microbiome, the types of bacteria that are supposed to be in the small intestine. Does that make sense? Right?
Yeah.
So chronic stress is one.
I was just thinking how fascinating it is, though, that like our stress and our mind is actually affecting the gut health, which is then affecting other things. It's just so, I was just like caught up in a fascinating daydream there as you were saying that. I'm like, this is just crazy. Like, yeah.
Yeah. See why I love my job? It's so much fun.
Nice.
Yeah. So stress is the obvious one that it's easy to say. A processed food diet is devastating to the gut.
Yeah.
High sugar diets are really horrible for gut health. Dietarily, I also see a lot of people who run into trouble because they're eating small, frequent meals throughout the day. And there was kind of this is popular in bodybuilding, and people really trying to pack on muscle.
Yeah, this is interesting. I'd love to hear your thoughts about this, right? Because I've actually had people on this podcast from both sides of it. I've had the intermittent fasting, keto, intermittent fasting type of people, fasting mimicking diet, those people.
There's a place for all of that. There's a place for fasting. There's a place for keto. But when we're talking about people with chronic IBS, right? So irritable bowel syndrome, we've got, tens of millions. I want to say it's like 50 million. Someone could
Wow.
quote me. Don't yell at me. Don't email me and say it's actually 45 million or 30. I don't know. There's way too many Americans have IBS, right?
Yeah, yeah.
And so they're having ongoing abdominal pain, cramping. Their abdomen is distended, it's bloated, it's big and pulpy. They say, I feel like I'm pregnant. They've got constipation, they've got diarrhea. They don't know what to eat. They're really reactive and they're suffering. And conventional medicine is just really not very good about fixing this.
Mm-hmm. Mm-hmm.
Right. So we see those patients and they often need a little bit different, more of an approach than say your average American, right? Though they need a different approach than someone who's just eating all the time, right?
Got it.
When eating all the time may be fine for someone if if they have no GI problems and they just really want to pack on muscle, they're getting the calories in. But the people we see have maybe thought that was a good idea and they've extended it for a year. And now they're just having trouble all the time. And the reason why that is a problem in some people, right? Depends on who you're talking to, right? The reason it's a problem is that the gut operates kind of on an on-off switch. And it's like, okay, we get food in, okay, we are going to start the digestive process. We're going to kick up the enzymes that are needed to dissolve the food. We're going to work on absorbing all the nutrients. And then there's like almost like an oven timer, like click, 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 click. And about 90 minutes later, it will turn to rest mode. And this is where the migrating motor complex is part of the nervous system that says, okay, time to relax and move everything on. This is the motility of the gut from moving food from top to bottom. If you're constantly eating, you never get that ding migrating motor complex to start up, everything backs up. So these patients tend to get way too many inappropriate numbers and populations of bacteria in their small intestines, and they get bloated when they eat. They get loose stools and diarrhea and abdominal pain. So that's the reason for, if you're having GI symptoms, that's why people feel better when they fast.
Right.
Because you're allowing more of those migrating motor complexes to help improve the motility. So that's the big picture. Not everybody needs to do that. You might have a super fast, amazing gut and you're eating really well and you're eating every hour. If you don't have symptoms, that's fine, right?
Yeah. Yeah. So where do
the people we see are kind of devastated with symptoms, right?
Got it. Yeah. So let's say for people who are devastated with symptoms. So first of all, let's say regular people, what would your advice be to like a regular person that's not like has a chronic devastating symptoms and
you never want a devastating system.
and then what's for those people who do have big issues, what do you recommend in terms of like eating? Like, are you a fan of intermittent fasting and only eating 2 meals a day for regular people, or should that only be more in extreme cases?
I'm a fan of people switching it up and listening to their body. So that's the first thing. I don't think there's one plan or one eating schedule that you should follow for the rest of your life. That you need different things at different times. That being said, I do intermittent fast. I feel best when I do it. And I try to kind of mix it up. So in a perfect world, actually I haven't done this in a while, so I don't want to pretend I do this all the time, but I typically feel really great if I do a 24-hour fast once a week.
Once a week.
And then maybe 3 days a week, I may skip breakfast and just start my meals with lunch. And so kind of more of a 16-8.
Yeah.
And then there's almost always a day where I'm just eating the whole day. Right. I don't have GI symptoms and it's kind of a feed day and I'm lifting weights and trying to get more muscle on my frame. Right. So I'm going to want to do a caloric excess. So I think it's important that we don't get stuck in the idea that, intermittent fasting, because XYZ expert says this is a good idea for insulin, that you just say, okay, now I have to do this forever. The body does much better when you can mix up the signals and keep it guessing.
I like that. And I kind of feel the same. The days when I'm lifting heavy weights, I feel the need to eat more. Yeah. And then I used to do it every month. I've kind of slacked the last couple of months. I got to get back into doing the 24-hour, I used to do like on a Saturday night, eat kind of a big dinner and then not eat again till Sunday night and do that like once a month at least. It's been a couple months though. I got to get back into that.
You and I both will get back on our fasting game.
Nice. Okay, great. So then what about the other side then? So yeah, talk about probiotics, because people are going to hear that and be like, oh, I heard probiotics. So they're going to go on Amazon and buy some probiotics or something. So what's the deal with probiotics? Do you use kind of like the regular over-the-counter ones, or do you have, I know a lot of doctors use very specialized, high dose ones. Talk a little bit about
You want me
that.
to tell you the secret about probiotics?
Yes.
After a decade in practice?
Yes.
This is something that's really misunderstood by conventional doctors. This is something that's really misunderstood by patients. Let's focus on people who have GI symptoms. Let's kind of focus our attention on those people. What we have found after lots and lots of experimentation is that you want the broadest number of species possible, because the honest truth is that we are not smart enough to micromanage the microbiome, right?
Okay.
People have this idea that if I do a stool test, or that I can say, okay, I'm getting these species on the stool test, therefore I'm going to pinpoint these probiotics. It's just a loser's game. It doesn't work. And I couldn't disagree more with people who are thinking they can change the microbiome because of that. I think they're reading tea leaves, they're getting inaccurate stool tests, and they're going kind of a little nutso on that. The honest, how we handle this is we know that there are study after study showing Saccharomyces boulardii helps with diarrhea and helps improve clinical outcomes if you add it to antibiotics. We know that there's hundreds of studies showing lacto-bifido blends improve outcomes in IBS, right? And then we even have studies with the soil-based probiotics showing improved outcomes in patients, not just like in a test tube, something happened. You give a patient with the disease a probiotic and you get a better outcome. So we take the approach in our patients who have severe GI disease is that we're not smart enough to micromanage, right? The people who think they are kind of telling themselves a story. We give lacto-bifido, sacro, and the soil base. We call them class 1, 2, and 3. And we have a product at our clinic that combines all 3 in one packet, right? So this is not a bottom of the shelf product. It's a great product, right? And we use it for patients who've really been struggling. But probiotics are extremely helpful. They're very, very safe. This is not the only way to do it. This is how we have found works the best for our chronically ill patients. And that's our approach.
Interesting.
Does that make sense to you?
Yeah, it makes a lot of sense. And also, like you said, there's no harm in taking bunch of different strains of probiotics. So, a lot of these stool tests that you take and then you ship it in and then they're like, oh, you're low in this one, which is like 2 weeks ago when you took the thing and sent it in and this and that, right? So now it's like 2 weeks later anyway.
You ready? It's actually even worse than that. So a stool test, you're pooping in a cup, right?
Yeah.
Poop is generated in the large intestine, in the very small, it's like end of the large intestine. And so doctors are using, a couple feet in the large intestine and thinking that they're giving you a representative sample of your small intestine, which is like 30 feet up. It just doesn't work like that. And the truth is that the largest density of immune cells in the gut is in the small intestine. That's where the real money is. Yeah. That's where all the absorption of nutrients happens. Most, 90% of the absorption is happening in the small intestine. That's where the interface with bile and enzymes is. That's where the beginning of the intestines is, right? That's where SIBO happens. So the real game is manipulating the small intestine. And so when doctors are taking stool tests and pretending that they can tell you about, the small intestine, I think they're misunderstanding how things work. The other thing is you take 2 stool samples, if on Monday and then Tuesday, or Monday morning and Monday evening, and you're going to get 2 different answers. Which one's correct?
Yeah. So you don't use stool tests at all, really, in your practice?
We do minimal testing because we see the harm that has been done to patients with just trying to go too much into these tests. There are problems with them. We do stool tests in patients who are struggling, when we're okay, Mary, we've done X, Y, and Z, and I would have expected you to be 30% better by now, but you're really not moving forward. I'm missing something.
Yeah.
And then we can be a bit choosier about when we do a test. And we try our hardest not to over interpret a test or over interpret blood work. But there are absolutely stool tests that can be incredibly helpful. So it's just picking the right patient to give the test to.
Okay, great. Anything else along the lines of gut health? We talked about probiotics and taking lots of different strains. Do you sell that probiotic product that you talked about that has all those different strains? Do you sell that to the public for people who maybe are not in your area and can't see you face to face?
Yeah. So I got into gut-based health after coming across my now partner, Michael Ruscio's work.
Mm-hmm.
So Michael wrote this amazing book. So anyone who kind of likes what I'm saying about gut health should read Michael's book. It's called Healthy Gut, Healthy You. It's one of the best books in functional medicine that I've read. And so I read this book and I said, oh my goodness, this guy knows what he's talking about. This is one of the pieces I've been missing. And then I started using it in my patients and they got better. And I did more of it and they got even more better, right? And so he's kind of been at the forefront of talking about how critical it is to get the gut healthy. He's got a website, drruscio.com, DRRUSCIO, that does does sell these supplements to the public. That's separate from our clinic operation, right? But they kind of go side by side. So there's absolutely, if people are interested, Healthy Gut, Healthy You. It gives a kind of how to do this yourself. I think it's $25 on Amazon. And so many people just prefer to do it themselves. And we're all about just trying to lower the cost of functional medicine, right? So these are premier products. They're not inexpensive, right? But if you can do it yourself, that's a lot easier. And then for the people who get stuck or they want our guidance, they come work with us, and that's great.
Got it. Yeah. Is there anything else? I know we got to wrap up soon, but is there anything else that you wanted to touch on? Otherwise, I would ask you to, please definitely let people know where they can learn more from you. And you mentioned the book, but in terms of your own clinic, and do you work with patients virtually as well in your clinic?
Yeah, we're all virtual.
So great.
We do the old school phone calls, right? And works fantastically. Really lets us listen to patients at a deeper level. So I'm the medical director of the clinic. It's the Ruscio Institute for Functional Medicine. It's RUSCIO Institute.com. And there are 4 of us clinicians. And we couldn't be more proud of our 2 youngest clinicians, Dr. Hannah and Dr. Scott. They are absolutely fantastic. They've been with us for over a year, and we are just thrilled to help kind of pass the baton to these guys. These are leaders, they're rock stars. So all 4 of us are taking patients, but I know it's easier to get into Dr. Scott and Dr. Hannah than Michael and myself these days. So, but any of us are happy to work.
Yeah. And what type of patient, like what type of issues? We mentioned people with gut issues, right? IBS, GI type issues. Are there other types of patients that have other kind of illnesses that you work a lot with?
Absolutely. We tend to do really well with the patients who've struggled. They've been to maybe an integrative medicine, functional medicine doctor, and they haven't got the results. We do really well with those patients. So if you left one of those practices and feel confused, we can almost certainly help. We love working with people to optimize their health, right? So if they're looking for just health optimization from doctors who are really obsessed about the outcomes, not just this sounds like a good idea to take methylation support, right? But working with the team that really kind of has our focus narrowed to just what are the outcomes. We love doing optimization work. We work with a lot of patients who have autoimmune thyroid problems. Hashimoto's thyroiditis is a really common autoimmune disorder. And is that something like thyroid and Hashimoto's? Are those things that you typically also address by addressing the gut? Yes. Wow. Nailed it. Absolutely. Yep. It's really fun. One of the first cases that made me really be like, okay, this gut thing works, is a patient who had autoimmune thyroid disease, fatigue, joint pain, depression, brain fog, on thyroid medicine. And I had done training through the Institute of Functional Medicine, and they had all of these ideas about giving extra nutrients and restrictive diets and all of these specific treatments. And I got nowhere with this patient. And this gal, or Kathy, right? She just got, I thank God she put up with me until I figured this out. But all of those things, we just chased, dose changes. Okay, so maybe if I just get the T3 a little higher and the T4 a little lower, and I try the iodine or the selenium, maybe I can get these antibodies and you feeling better. None of that worked until I treated her gut. And she actually was one of those patients. She didn't have gut symptoms. So she had a really disordered gut. And when I treated her gut, boom, you saw her antibodies just fall to the floor and she thrived. She felt
Interesting.
Great.
Interesting.
Yep.
What are some other conditions like that where people wouldn't think necessarily to treat the gut, but you've seen results treating the gut with people?
So two that come readily to mind, well, maybe three. One would be rosacea or acne. So rosacea is a red discoloration. It's kind of a form of autoimmune vasculitis, typically. Usually there's a red discoloration around the nose, cheeks, usually some papules. That responds great to the gut work. So in my mind, when I see rosacea, that's a disordered microbiome until proven otherwise. Not every time, but a really high chance of success for treating that. Joint pain, so reactive joint pain, or rheumatoid arthritis often responds really well to gut care. And then I would say anxiety and depression. There's a surprising number of cases where we can see improvements in mood and energy just by treating the gut. Again, not every case, because this is not, it's not, I don't have a magic 8-ball with every patient and say, you are the gut. And we don't go gut for everybody, because sometimes someone's just sick from a moldy house.
Right.
Or
I mean, you're in New Orleans, right? A lot of fried foods in New Orleans, right? I mean,
yes, sir.
If people, I mean, if you give people probiotics, but they continue to drink alcohol and eat fried foods and things like that, right? Is it, I mean, it's not going to be, it might give them a little short-term relief, but not going to really fix the issue, right?
No, I have a really one of my favorite patients, actually. He drinks too much. And I got him about 70% better. And all the tools, and he really struggled with a number of providers, but we got his pain and his gas and the morning diarrhea down about 70%. So he can leave his house in the morning. He can go on flights and he can do really well. But he's not perfect. And I was like, my friend, you're drinking 3 to 6 servings of alcohol every day. I can't get you better. And we joked at the end of the visit. It's like, all right, abstinence or flatulence.
Right.
I can only get you so far if you're continuing to hurt your gut.
Yeah.
And look, I'm not here to fuss at him and tell him what to do or not to do, but I'm going to lay it out as best I can and say, hey, look, I think you're holding yourself back. If you value getting these symptoms gone, you got to stop drinking.
Yeah.
If you value drinking more than these symptoms, then you're going to drink, and nothing I say will change your mind.
Right.
So we're just here to do the best we can and meet people where they are. Right.
Yeah. How bad do you want it? That's what I say to people. How bad do you want it?
Yeah. So, exactly.
Well, this has been amazing. Thank you so much. And again, so is it Ruscio? The best way for people to learn more from you is the RuccioInstitute.com.
Exactly right. That's it.
RuccioInstitute.com. And so you guys are all virtual, so people can schedule, consultations with you guys and work with you from that matter.
Everywhere but New York State. And so the New York Staters just got to take it up with their state legislature.
Oh, wow.
Yeah. We've got patients overseas, Brazil, New Zealand, Australia, Canada, Italy, across the states. And so it's pretty fun. We get to see the patterns kind of worldwide and where people are finding success and where they might be missing something.
Very interesting. Very interesting. Well, thank you so much. I learned a lot today. Definitely a lot about gut health, a lot about different stress management, and probiotics, and how you're approaching things. So this was incredibly valuable. I'm sure a lot of people got value. So thank you so much for sharing your knowledge here today.
My pleasure. Thanks for having me.
Thank you. Thanks for listening. And just a reminder, if you haven't yet tried any of our Peak Performance products, you get 20% off your first order. We have one of the largest selection of USDA certified organic superfood powders, as well as very high quality supplements. And you get 20% off your first order at buypeakperformance.com. That's www.buypeakperformance.com.